All right, so you've just had your male sling procedure, and you're probably asking yourself, okay, now what? Well, you're in the right place. Think of this as your personal roadmap to getting back on your feet smoothly and safely. Let's walk through it together.
Right, the surgery's in the rearview mirror. So what happens now? We're going to walk through all the crucial next steps. We'll cover everything from what to expect in these first few days, how to handle your activity levels, and even some diet tips to help you heal up. And, most importantly, we'll talk about the signs that mean it's time to pick up the phone and call your doctor. First things first, let's talk about what you might be feeling right after the surgery. It's totally normal to notice some, new sensations as your body starts to heal. And honestly, just knowing what to expect can give you a whole lot of peace of mind. So it's really common to see some bruising, maybe a bit of swelling in the scrotum, and feel some mild pain or discomfort right around the surgical area. You might even notice a little burning when you urinate or that your stream is a bit slower than usual. Don't panic. This is all a normal part of the healing process. It's just your body's way of saying, hey, I'm working on it. How you move is just as important as how much you rest. So let's dive into your activity guide. Getting this right is absolutely key to making sure that Sling heals perfectly. Here's a quick look at your recovery timeline. Day 1 is simple. Absolutely no driving. For the first 3 weeks, you'll want to put any long trips on hold. The good news? Around week 4, you can usually get back to sexual activity and more vigorous exercise. And here's a big one to remember. That restriction on straddling things, like riding a bike or a motorcycle, that lasts for a full 6 months. Let's talk about lifting. For the first 4 weeks, 20 pounds is your absolute max. Now, what does 20 pounds feel like? Well, think about a couple of gallons of milk, or maybe a really full bag of groceries. Anything heavier than that is just too much strain on the area while it's healing. Think of it this way. Your do list is all about being gentle and consistent. Walking is your best friend. Using a cushion when you sit can make a world of difference. On the flip side, the don't list is all the heavy-duty stuff. No intense yard work, no straddling activities, and no long road trips for a bit. The goal here is balance. You want to stay active, but you definitely don't want to overdo it. I love how the instructions put this so directly. Do not be a couch potato. It sounds simple, but it's so important. Walking gets your blood flowing, which is fantastic for reducing swelling and speeding up your healing. So get up and take a few short, gentle walks throughout the day. Okay, let's switch gears and talk about what's happening on the inside. What you eat, how you manage your daily meds, and even your bathroom habits. All of these play a huge part in helping your body do its recovery work. Trust me, the last thing you want right now is to be straining on the toilet. So you have to be proactive. Here's a simple 3-step plan. First, drink plenty of water. Second, load up on fiber, fruits, veggies, you know the drill. And third, don't be afraid to use a stool softener. This will help you avoid putting any extra pressure down there while you're healing. When it comes to pain, the good news is that you probably won't need any heavy-duty narcotic medication. For most guys, simple over-the-counter stuff like ibuprofen or Tylenol does the trick. You can also get back to your normal pre-surgery medications, but, and this is really important, if you take blood thinners, you have to follow your doctor's specific instructions to the letter. All right, next up, taking care of that incision. Keeping the area clean is your #1 defense against infection, so it's a really essential part of healing up properly. And the process is super straightforward. First, you're going to wait 2 full days after your surgery. Then, you can start taking daily showers. Just let the warm water and soap run over the incision, maybe give it a gentle wash, and then carefully pat it dry. No scrubbing, nice and easy. Now, this next rule is a big one, and it's not flexible. No soaking the incision. That means no baths, no hot tubs, and no swimming for 6 full weeks. Soaking can introduce nasty bacteria and really mess with the healing process. So for now, it's showers only. Okay, this last section is probably the most critical one. Knowing what's normal is great for peace of mind, but knowing when to call for help is what really keeps you safe. So let's go over the red flags. So how do you know when something crosses that line from normal healing to a potential problem? Let's get really specific about the signs that mean it's time to make that call. If you experience any of these things, don't wait around. A fever over 101 or getting the chills. If the incision starts to look angry, really red, swollen, or if there's any pus. Severe pain that your medicine just isn't touching. If you're feeling nauseous and throwing up. Or if you have that awful feeling that your bladder's full but you just can't urinate.
Any of those are your cue to call the doctor's office right away.
Keep this info handy. For any of those concerns we just talked about, or really any question at all, use that office number. But if you're facing what feels like a true medical emergency, don't hesitate. Call 911 or get to the nearest ER immediately.
As we wrap this up, just remember, you are the most important person on your recovery team. Following this guide, really listening to your body, and not being afraid to ask for help, those are the real keys to a successful outcome. So, what's the one step you can focus on right now to make sure you have a great recovery? We wish you a speedy and smooth healing process.